Dr. Bodenheimer and Dr. Thompson, thanks so much for joining us again today.
Absolutely, happy to be here.
Good. I know some of our viewers have already seen you on our show, but for those who may have missed it, let's reintroduce yourselves and tell us a little bit about what you do.
Absolutely. My name is Nick Bodenheimer. I'm originally from High Point, North Carolina. I went to medical school at Virginia College of Osteopathic Medicine in Blacksburg, Virginia. I finished residency at New Hanover Medical Center in Wilmington last year, and so I recently joined the practice.
Great, great. How about you, Dr. Thompson?
My name is Richard Thompson. We have pretty astonishingly similar backgrounds. I'm from Virginia. I also went to Virginia College of Osteopathic Medicine and finished residency at New Hanover Regional Medical Center. And I've been with the practice for a little over a year and a half now.
Speaking of the practice, tell me a little bit about the practice. How many providers do you have in the practice now?
Right now we have myself, Dr. Thompson, Dr. Shue, Dr. Toller, and Dr. McCarthy. We also have Sarah Brown, who's a nurse practitioner who is wonderful.
She is wonderful. We've had her on the show
Absolutely.
before. Yeah, patients
Yeah,
love
she's
her.
great.
Well, I know you've recently added the Carolina Shores location to your practice. Will both of you be seeing patients here?
Yes, for sure.
That's great. I know they're going to be glad to have you in the southern end of the county. It will be more convenient for folks who live down this way.
Absolutely, we're happy to be here to help out.
Yeah. Are there others in your group who will be here?
Yes, there will be. We'll have Dr. McCarthy will be down here, Dr. Shue as well. Will also be here on an intermittent basis. There will have coverage down here on every week at the very least.
Yeah. What kind of services will you provide here?
Down here we'll be providing routine obstetric and gynecologic care. One of the nice things though about this office is the imaging center too.
That's great.
That will be able to, evaluate people with imaging at this area. They don't have to drive all the way to the hospital to get those services. And we have a lab in here too.
Well, so will you be able to provide any other procedures or surgical options here?
Here, we'll, as Dr. Bodenheimer said, we'll be serving mostly as routine GYN care, but we will continue to offer our normal procedures that we do at our main office location in Bolivia, as well as the hospital in Bolivia. So.
We talked to Dr. Tillotson briefly about minimally invasive procedures at the hospital. Both of you, I assume, do minimally invasive procedures also? Is that correct?
Yep.
And do either of you do the Da Vinci robot?
Both of us do. We both offer robotic hysterectomies, total laparoscopic hysterectomies. We also offer surgical intervention for pelvic floor prolapse,
Yes.
which is also a really great procedure that allows patients to have a great result. In most cases, be in the hospital one night.
Yeah.
And
Very
go
little
home.
downtime with that. Yeah,
Very
that's made a
little,
huge
yeah.
difference in that procedure.
Yeah, for sure.
Yeah.
Absolutely. The robot, the Da Vinci robotic system is great because, there's a time when you would have to have an incision in your belly to get, a certain size of uterus out or so forth. But with the robotic system, we're able to do all of that laparoscopically. Like Dr. Thompson said, you're usually in the hospital one night and you get to go home the next day, and people do well. They require minimal narcotic medication. It's really exciting.
Yeah, absolutely. That's great. Well, for patients who have a question or want to schedule an appointment, how might they do that?
They can call our main office number, which is 721-4050. That would be the best way to go about scheduling an appointment.
And they can schedule at any office through
Correct,
that number.
yeah.
Great.
Yeah,
Well, thank you so much for being here today. We appreciate all your time.
Absolutely.
Yeah,
Thanks
thank
for
you
having
very
us.
much.
You're welcome.